Florence Comite, and we're here with Shannon Rego, who is a licensed genetic counselor at the Snyder Labs, the Department of Genetics at Stanford University. We're here at the Age Management Medicine Conference in 2017, and for the first time in Tucson, Arizona. We're going to talk about the topic of personal omics data beyond the genome as informative for precision medicine and preventative care. Welcome, Shannon.
Thank you.
It's delightful having you here. So we want to start with the question, why do you think genomics data is so valuable?
Well, I think genomics data has become an increasingly important part of medical care today, and for a long time it was really being used in clinic mostly to diagnose people who had suspected genetic diseases running in the family. But now more and more it's actually really useful in the context of healthy people and better understanding disease risk.
Exactly, so you can motivate people in ways, and you can also help them understand why perhaps they need to take better care of themselves before symptoms emerge.
Absolutely.
Make sense?
Absolutely.
I guess another issue in terms of being a genetic counselor and trained to work with individuals who might have fears or concerns about finding something untoward is, how do you work with those individuals who might be afraid of what they learn, and knowing what runs in a family might get confirmed, such as Alzheimer's or breast cancer or prostate cancer? What do you recommend that physicians and other clinicians need to know?
Right, well, when I talk to patients about undergoing genetic testing, we talk a lot about what the possible outcomes of that testing could be. And there's some differences depending on whether someone is undergoing testing to diagnose a known disease in the family, or if they're undergoing testing as a generally healthy person. In the first situation, we're talking about incidental and potential secondary findings that may be totally unrelated to the reason they undergo testing, but could potentially be really valuable information for their future health care. For example, if they were to find that they had high-risk mutation for cancer, even if that's not the reason they underwent testing to begin with, that would really inform their care going forward. So I talked to them about whether or not that's the type of information that they'd want to know, and asked them to give that some thought before we would proceed with testing, for example. In the context of someone undergoing testing who's healthy, it's really a lot of the same thing, except that's often what they came to the table for to begin with. They want to have a better idea of what their health risks are, so that if it's possible to do something to alter their environment, that they can go ahead and do so.
Exactly. What kinds of things do you recommend when you think about altering the environment tied to genomic risk of disease?
Right. Well, of course, for some genetic diseases, there isn't anything that can be done to alter risk. So that's definitely something I talk to patients about and research participants before they test. Is that something they'd want to know, to learn about a disease, for example, that has really, at least at this time, no interventions, nothing that can be done to mitigate risk. Yeah. But there are so many diseases where you can do something to mitigate the risk. Oftentimes it's dietary interventions or exercise, other lifestyle changes that can really impact your risk. And a lot of folks are interested in taking action to try to reduce their risk however possible.
Exactly. I think that's the exciting era we're in right now. We're learning all about that here at the Age Management Medicine Conference. I encourage clinicians to open their minds and understand that we're entering a whole new era where we can actually predict and detect what's going on and hopefully own our own health trajectory. In some ways, the practice that we are looking towards is perhaps our genes don't have to be our absolute destiny, and even there are some tools like CRISPR and others coming along in the future, we might be able to change our very gene and genetic makeup.
Right, it's a really exciting time to be working in the genetics field, and no doubt to be a physician involved in genetics as well.
It is, it is. I've been looking forward to this time for 20 years. And I think we're undersupplied with genetic counselors, so you must be bombarded, and I thank you for all the help you give us and you give people in general.
My pleasure.
Okay, it's great. Thank you for coming.